What's up, everybody? Dr. Bonzo back again with another quick-hitting, high-yield review of a medical topic. If you like that kind of content, be sure to check out my YouTube channel and subscribe, Dr. Bonzo. Today's topic, thyroid nodules. It's an easy one. So first question is, what are the two things you order when you have a patient that has a new thyroid nodule? Number one, check a TSH level. Number two, thyroid ultrasound. Now, a lot of people like to order the whole thyroid panel to get the TSH and the thyroxine level, your free T3, free T4. All you need to start out is just a TSH level. You'll see that a lot of times on tests where they'll ask you what's the one test you want to order for a suspected thyroid problem. The answer is always just the TSH alone. Don't get tricked and say TSH plus T4. In real life, a lot of times you can order a TSH test that has a reflex. So if the TSH is abnormal, then the lab will order the other test. So far, what we got, thyroid nodule, get a TSH level by itself, get a thyroid ultrasound. Let's do the ultrasound first as far as what you do with the results, because that one's easy. If it shows a thyroid nodule that's greater than 1 centimeter, you need to send them to your ENT colleagues for a biopsy. That's when you start worrying about things like malignancy or other problems. Now, one caveat to that, if you're seeing a kid, a pediatric patient, typically you refer those out to your peds ENT folks for thyroid nodules just across the board. Thyroid nodules in kids are pretty rare and a lot higher risk of having a malignancy in a kid with a thyroid nodule. So for the most part, we're talking about adults as far as that 1 centimeter cutoff. Now, the initial biopsy test they usually do is an FNA, a fine needle aspiration. And two kind of caveats that you'll see on exams sometimes. Number one is that if you do the FNA, or the fine needle aspiration, and it comes back inconclusive or inadequate cells, then you will refer them back again for an open biopsy. If you actually do the FNA and during the procedure, it actually collapses the thyroid nodule and it disappears, then in that case, you're actually good to go. Assuming, of course, that your aspiration didn't show any cancerous cells. So again, so far we got our TSH, our thyroid ultrasound. If you see a nodule that's more than 1 centimeter, send them for a referral. Initially, a lot of times the initial one for smaller nodules are just a fine needle aspiration. If the cells don't show any cancer, if the nodule pretty much disappears with the aspiration process, you go ahead and you're good to go. If it shows any cancerous cells, obviously, then they're going to be referred for definitive treatment. And also, if you get an inconclusive result, then you're going to get definitive diagnosis with a full biopsy. Now, this last part is what we do with the TSH result. So if your TSH is low and you're suspecting hyperthyroidism or a hyperfunctioning nodule, then you will refer them for a radionuclide iodine scan. And so if that shows a hyperfunctioning nodule, then you would actually refer them to your endocrinologist to get your radioactive ablation therapy done. Remember that radioactive iodine molecule, the I-131, you would send them for that. Now keep in mind that people who are not eligible for radioactive ablation with iodine are people who have monocular vision, kind of only vision in one eye, because there is a risk of exophthalmos during that procedure. And also anybody who's not willing to kind of isolate themselves and not be around like little kids and that kind of thing. So far, in summary, thyroid nodule, get a thyroid ultrasound, get a TSH. If your thyroid ultrasound shows a nodule greater than 1 centimeter, you're going to refer them for FNA biopsy. If somebody's TSH is low, then you're going to get a radioactive iodine uptake scan. If that's abnormal, then you're going to send them over for radioactive ablation therapy with your I-131. Okay? Oh yeah, and of course, with pediatric patients, go ahead and refer them early because they have a much higher risk of malignancy. All right, that's it. Dr. Bonzo, 5 minutes or less, thyroid nodules.